Please join me in welcoming Jenny.
So I'm delighted to share with you a different perspective on behavioral health today, specifically focused on the role of telemedicine. I know telemedicine might be relatively new to some of you, having only recently are all the legislation kind of shifting across the country to really allow for you as employers to offer this as a benefit to your employees. However, in behavioral health, this actually has been utilized for some time. And it is particularly beneficial for behavioral health, for psychology and psychiatry. And so I'll speak a little bit about that, why in particular. Having my background as a clinical psychologist, I was actually quite familiar with it from that place. And so I'm excited to see that we are expanding and able to do this now in terms of thinking about urgent care, and we're actually going into specialized care and medicine as well. But today we'll focus particularly on behavioral health. All right, so behavioral health, as you all probably are well aware, is a term that covers the full range of mental and emotional well-being. When we think about it, we think about how people are coping day to day in terms of challenges of life. And thinking, oftentimes when we think of mental illness, we're thinking about depression or anxiety. And it also encompasses treatment for other specific disorders, such as substance abuse and addictive disorders. Obviously, those are kind of top of mind right now with the opioid epidemic, but then obviously it spans much beyond that. When we think about this problem, obviously, it's not insignificant, which is why we're getting a lot of attention these days about thinking about access and equity for mental health issues. 1 in 4 American adults experience mental illness every year. And for me, I always, even though this is my background, I still find this statistic staggering and also quite compelling for why it's so important for you all as employers to really be mindful about the mental health of your employees. If you want productivity, or if you want just if you're thinking about the wellness of your employees just from a holistic perspective, this is where there's a lot of opportunity. Put a lot of focus here on caring for them. Sadly, only 41% of this population receives treatment. We need to improve. Obviously, there are some hindrances in place, and it's being mindful of those and thinking about what is causing this disparity in treatment for this particular area of care. So 14 million Americans have a serious mental illness, and sadly, they're dying at an average of 25 years younger than the general population. About 9.2 million adults have co-occurring mental health and addiction disorders, and then 20% of youth ages 13 to 18 experience severe emotional disturbances. These are really mind-blowing statistics, I think, and really help us kind of focus our attention on why this is important. And not least, suicide is the 10th leading cause of death, more common than homicide, and is the 3rd leading cause in people ages 15 to 24. Really important issue for you to be mindful of for your employees. When we think about behavioral health conditions, they're quite broad. So depression, anxiety, probably the ones that come to mind most readily for people. Stress, though, panic attacks. People are talking a lot more about panic attacks. I think people have growing awareness of what that looks like. Insomnia, eating disorders, postpartum depression, attention deficit disorder, and obviously really causes challenges for the person who is encountering this, but not only for them, but for their family. To complicate this, we have a shortage of providers. This is a real challenge. We're talking about 40% of the people with mental health issues are getting treatment. We also have a shortage of providers, which complicates this matter. 1 mental health provider exists for every 790 individuals. Remember, the statistics is 1 in 4 for adults. We probably don't have enough in this regard then. 4,000 are approximately the amount of mental health professional shortage in areas in the U.S. And Congress found that 55% of the nation's 3,100 counties have no practicing psychiatrists, psychologists, or social workers. 1 to 30,000 is the ratio for psychiatrists, and nearly 80,000% of all psychotropic medications are prescribed in a primary care setting. Where that is actually, I think, notable is that the medication is only part of the treatment that your employees actually need in terms of addressing the mental health issues. It's much more complicated than just prescribing medication. So, telemental health. I have to tell you, I came to telehealth because I became so excited about it when I was on the provider side as an executive in a healthcare organization, realizing the impact that we were actually able to have when we started expanding our access through telehealth. And I became quite passionate about what that could do, and so that's why I'm here, and so I'm excited to share with you why that's important. It provides valuable and meaningful solutions, specifically access. When we were talking earlier, just a few seconds ago, about the shortage that we're seeing across the country, if you're able to have a network of providers that's accessible across the country, irrespective of your location, the impact can be quite meaningful. When we have 60% of the adult population not receiving care for the disorders, this can be meaningful. What we're able to do is bring a network of providers that are licensed across the country to your employees, irrespective of where they are. I know in particular that Wisconsin struggles with having a lot of rural populations, and it's challenging oftentimes to get to the provider. You have to drive a far distance. If you're able to do this in the convenience of your home or from your workplace, you're able to actually find someone who can care for your needs right there where they need it. And not only for the adults, but also for their children. Quality of care. Telehealth is able to ensure there's quality of care. Not only because you're able to if you have a network of providers that is overseen, as we do, and I'll talk a little bit about that, oversee the network of providers, be able to ensure quality. But also, what's really exciting is the research in behavioral health, because it's existed for a longer period of time, and psychology, we actually have studies now that have demonstrated the success of telehealth. And what we find is not only does it, in fact, address all of the issues at the same rate of effectiveness, but also we see that the effects of that treatment actually persist for a longer period of time. Meaning, rather than needing to go back into treatment, what they learned through their treatment and their telehealth treatment, they actually are able to continue and persist to use those strategies effectively to reduce the incidence of reoccurrence. I find that to be exciting. Improved outcomes, cost of care. You can imagine the cost of care that is reduced when you're able to actually deliver this in-house. You have all of the reduction, not only in travel costs for you and for your employees, but also in terms of just the basics of it. Brick and mortars are more expensive. You're able to have lower overhead and actually reduce the cost of care. Addresses the issue of stigma. How often do we know of people who actually aren't getting their issues addressed because they feel concerned about letting other people know? There's small communities. They're afraid that someone's going to know that they're going to their local psychologist, psychiatrist, therapist. And people feel uncomfortable accessing the care they need, not wanting other people to know. Telehealth takes away that stigma because they're able to do it in the convenience of home. They don't need to feel as though maybe that it's going to be as public as they might fear it would be were they to go to a brick and mortar. Also, the convenience, we just talked about that. Our platform, not only are you able to access it through web-based, but also mobile, tablet, and then you're able to schedule based on your needs and demands. Reduction in cost control for inpatient admission, care coordination. These are all kind of larger issues, which I can talk about at a later point if someone's interested in talking about more of those kind of specifics. And then also just kind of thinking about the shift to a value-based payment model. As we know, healthcare is shifting, and as we're shifting, this is where we're able to actually think about the opportunities here for behavioral health. And then rather than having the mental health dollars only go towards prescription drugs, we're able to also see them go into outpatient treatment. So I'm going to tell you a little bit about American Well. American Well is a wonderful telehealth solution. It's a telehealth company that offers software as well as clinical services. We're partnered with over 170 health systems and health plans, over 1,500 employers nationwide, and we just continue to expand and grow. It's exciting to see how telehealth is really taking off. And we say health plans are actually willing to reimburse now at increasing rates because they see the value add, and they're also seeing the reduction in cost of care. We have over 5,000 providers currently providing online, and we have the online care group, which is our own provider group that has an exclusive relationship with us through American Well. They actually provide 24/7 care for medical conditions, and then also 7-day-a-week care for our behavioral health. So these are the kinds of behavioral health provider types that we have. We have psychiatrists. They are available in all 50 states. Psychologists and therapists, also available in all 50 states. Our psychiatrists, as you can imagine, are basically doing medication management, and the appointments look like you have the initial evaluation, a roughly 50-minute appointment for that, and then the subsequent medication management are for 15 minutes. And then the psychologists and therapists are providing therapeutic visits where they're actually able to engage in therapy, and those are for 45 minutes after an initial evaluation. So why use the online care group? They're dedicated to providing care all 7 days so that your employees are able to access it when it's comfortable and convenient in their schedule. What also is really important, as I was talking about, is it's actually a tight network of providers. And so we actually do a lot to ensure the quality of the care. We have protocols in place. We have weekly meetings. We manage closely what they are providing. We review notes. We do audits on the notes. And we actually have weekly calls and post boards. So there's a real tight quality assurance to ensure that your employees get quality care. They're also, because American Well provides the software, so American Well is the software, the online care group are the provider group. The software enables also to have sharing of information. So not only are you able to ensure that the various different behavioral health providers are able to see the notes if they happen to be shifting from the psychiatrist to a therapist, or they need to switch therapists because for some reason maybe the therapist has gone out on maternity leave or something of that nature. They're able to have consistency because the information is there. But not only that, if they need to leverage any of the medical care also on our platform, that also is available. So you're able to have continuity of care among the providers that are providing telehealth on the platform. So as I was saying, the coverage is available in all 50 states, provide master's and doctoral level clinicians. We have 24-hour clinical on-call backup. And this is important because we do have emergency services that are available. Not only does they're called our Network Operations Center, do they provide the 24-hour on-call backup and ensure that they can reach out to whoever is available and on call, but also in emergency situations, they're able to reach out. So if a therapist or a doctor is online with a patient or one of your employees at a time, when they actually are in a crisis situation, the Network Operations Center is right there on the back end to make sure that they're able to oversee the emergency services. Sadly, and yet at the same time, I'm glad to know that we have the support. We had someone who actually had a suicidal incident while they were on the phone. And because we had the Network Operations Center there to support, the therapist was able to stay online with the patient and ensure that they were staying present with the patient. Meanwhile, the Network Operations Center was able to reach out and through our services, coordinate care and make sure that they had someone there before they got off the line with the therapist. And that's the quality that we believe in. We believe that we recognize responsibility of providing telehealth, that it goes beyond just that patient and provider relationship, but also that we're providing these other services to ensure the safety and well-being of your employees. As I was saying, we have a strong commitment to quality, the monthly chart reviews, case reviews, screening tools, and a lot of experience. Because we actually have been around a while, we have a tight network, we have a lot of guidance. The president of the online care group is our chief medical officer at American Well. We work closely together. And so because of that, we have experience in doing this, and we leverage that experience in making sure these protocols are robust and that we have the quality assurance that we need in place. The other thing is we recruit providers who use evidence-based techniques. We recognize the importance of doing that. We recognize the importance of quality, and so we're really committed to that. And American Well is actually provider-led. Many of us in the leadership roles are actually providers ourselves, and so we bring that lens to this and recognize the importance of making sure that we have high-quality care. So in terms of thinking about what the offerings are, we have therapeutic services, as I was saying, psychiatry services. The therapeutic services are available for both adults and adolescents. Psychiatry is for ages 18 and older at this point. We are talking about possibly going a little bit younger over time. We have a bridge program that can help support for follow-up care after admission in the hospital, an in-clinic model, as well as a corrections program. So we're building out all of these services, recognizing the needs are great. We have a shortage of provider. We need quality care. And so we're excited to be able to provide that. I recognize that you guys are at a point of needing to think about this probably for your own organization. And as you're doing that, I do recommend that you consider the value of telehealth and what it might bring for your employees. And if you have any questions, feel free to reach out and ask me.